Hello, my name is Bailey, and this is for the Adult Health 2 Module 7 assignment. We're going to be going over um, two musculoskeletal conditions that are common for patients. So the first to review, as you can see, is arthritis. Arthritis involves inflammation of the joint or joints. Most common types of arthritis are osteoarthritis and rheumatoid arthritis. Osteoarthritis involves more wear and tear damage to joints cartilage, which is like the hard, slick coating on the ends of the bones where the joints usually form. Cartilage cushions the ends of the bones and allows pretty much near frictionless motion of the joint. But of course, if there's not enough, damage can result in the bone from grinding, over time, which of course pain occurs and restricted movement. Rheumatoid arthritis, the body's immune system attacks the lining of the joint capsule, which is the tough membrane that encloses the joint parts. This lining, which is the synovial membrane, becomes inflamed and swollen, and this disease process usually ends in destroying the cartilage and bone as well. So, of course, furthermore, we're going to go over a little bit of diagnostic testing and manifestations for both. And then if you see in the photo here, I have also like a healthy joint, what osteoarthritis, rheumatoid arthritis would look like, and then also another picture illustration of what this may look like. For diagnostic testing, this can usually include testing on like bodily fluids. This would look for like inflammation markers, possible infection. So this would be like blood. There also is testing that can be done on joint fluid to see what condition is occurring, of course, done by biopsy. Other diagnostic testing used could be like X-rays, CTs, MRIs, ultrasounds, just to give a visualization of what is happening, of course, depending on the patient and what is needed to be reviewed. Clinical manifestations for both types of these arthritis are generalized pain in joints, stiffness, swelling in joints, redness in the joint area, and decreased range of motion of the joints infected. And then osteoarthritis, patients may have a like grating sensation when they're moving the joint, with hearing a popping or cracking sound. They also have tenderness when touching that specific area. There are also a chance for bone spurs to develop if the joint isn't, of course, going on and on without being treated. Rheumatoid arthritis, the patient may have complaints of more like fatigue, fever, loss of appetite. This condition also impacts smaller joints like the hands and feet, and this usually occurs first. This condition also can impact other areas of the body like skin, lungs, heart, nervous tissue, and etc. It doesn't just always impact the joints. For interprofessional care, there is no cure for either of these conditions. The care that really focuses on managing pain and inflammation, preventing disability, and really maintaining and improving joint function. Non-drug interventions would be are really the basis of arthritis management. They should be maintained throughout the patient's treatment. The patient should rest the body and joints when able to. They should also protect themselves from injury, use assist devices needed like a cane or walker. Patients can also use like heating pad, cold application when addressing the pain and stiffness. Nutritional therapy and exercise are also needed with these conditions. This would include like weight loss programs, dietary changes, and staying active. Aerobic conditioning, range of motion exercises, and programs that strengthen muscles usually help the affected joints for the patient. Alternative therapies can be patients like using acupuncture, massage, any like movements like yoga, tai chi may help reduce arthritis pain and improve joint mobility. There are some nutritional supplements such as like fish oil or ginger that helps with anti-inflammatory needs, but this also should be referred to from the physician. Treatment plan of course, other than what was already mentioned, we'll start with like NSAIDs for inflammation and pain. And then there also is like counter irritants, which are like creams that can contain an ingredient that interfere with the transmission of the pain signal from the joint itself because it's focusing on somewhere else. Steroids are also used for inflammation, pain, and slowing the joint damage. There are also disease-modifying anti-rheumatic drugs, which help the progression of rheumatoid arthritis. You don't cure it, they just help with progression. Physical therapy will be needed as well for these patients. Serious cases, there are surgical options. Joint repair can help smooth joint surfaces and realign them to help with pain and function. Joint replacement can, completely replace the affected joint, which will help, which is usually like hips and knees. There are also a joint fusion for smaller joints that takes both ends of the joints and locks them together so they heal together. This can help with some of the pain as well. These treatments also, can be varied across the board depending on what the patient has and what they're looking for. Okay, and then so for nursing diagnosis, this will be mostly focused on the osteoarthritis part of this condition. So the one that I created was a chronic pain related to joint degeneration as evidenced by reports of a pain level of 7 out of 10 and facial grimace. 2 outcomes will be that the patient will report a satisfactory pain control at a level less than 3 or 4 on the 0 to 10 pain scale. And then also the patient will exhibit increased comfort and have such baseline heart rate, blood pressure, respirations, and relaxed muscle tone and body posture. 2 interventions is the nurse can help with changing positions frequently, maintaining functional alignment for the patient, because of course poor alignment can cause discomfort. The second intervention is administering medications for pain before intense activities in physical therapy, because exercise, it may help the joint mobility, but patients could also be reluctant to participate because they are in too much pain. Evaluation, the nurse will evaluate the patient's descriptions of their pain, see if any relief has occurred, document if any pain is still occurring, and see if these needs are not met, they can adjust their care plan as needed. Patients will need to be given all information relating to interprofessional care for teaching options. Of course, cold therapy, over-the-counter medications, supplementations, activity needs, also that they'll need the physical therapy as well. Encourage them to see their provider for follow-up routine assessments. They should also avoid using forceful, repetitive movements, awkward movements. This will help the joints not be so stressed. The nurse also may need to, teach them how to use a walker or grab bars at home if needed. And then moving on to amputation, as you see here, there are 2 different types of amputation. This is the removal of a body extremity by trauma or surgery. It can be any body part, toe, finger, hand, arm, leg, whatever it may be. Surgical amputation is if the tissue destruction from possible infection or disease makes it impossible to repair or could endanger the patient's life, which you see in figure 3 here. This is surgical. Traumatic amputation occurs from like a car accident, occupational accident, or combat. This is about 45% of all amputations. So this could be cut off, torn away, to the point where maybe it can't be saved, or sometimes it can, which in figure 3 or 4, I should say, you see here the traumatic occurrence with the hand, and then it is stapled back on. Of course, diagnostic testing, really is more for checking for other issues, like seeing if there's any infection with getting a white blood cell count. Vascular tests can be used to make sure that either the amputation was done correctly surgically, or to see if it can actually be, put back on if needed. This really just depends, of course. Clinical manifestations for this condition is really straightforward. Of course, if a patient's missing a limb, they know right away. So traumatic events, this would be pretty obvious. Other factors that could, include, needing an amputation would be like cancerous tumors, frostbite, gangrene, peripheral artery disease, which of course prevents blood flow to the limb being impacted. So it really depends. Signs and symptoms depends on what the patient's really experiencing. So swelling, fever, wounds that are presented that are infected for that area. So that would really specifically depend on what's going on. Interprofessional care would just really assessing the patient's health in general. Chronic illnesses and infection need to be managed before the amputation can be done. The patient, the caregiver need to be understanding that, rehabilitation is needed to really help with the quality of life. If this is, of course, done traumatically, the patient will need more of like emotional support along with physical therapy to make sure that they're, understanding of what's going on. And of course, we want to make sure the patient is stable before surgery is safely done, so they're not bleeding out, anything like that. Treatment is really straightforward. Of course, it's usually surgery. The limb will be either removed or repaired, depending on the situation. And of course, treatment will also include the emotional support, physical therapy, coordination of getting a prosthesis, and just really depends on what the patient is needing for us at the time. Nursing diagnosis will be impaired physical mobility related to the loss of limb as evidenced by reluctancy to attempt movement. Two outcomes. The first will be that the patient will demonstrate techniques or behaviors that enable resumption of activities. And second will be the patient will display willingness to want to participate in activities. Two interventions is the nurse will assist with specific range of motions that will help with both the affected and unaffected limb beginning in early preoperative stages, or postoperative stages, I should say. This prevents deformities, helping not delay any fittings for their prosthetic. Also, the nurse will help transferable techniques with helping them how to use a crutches, walker, trapezius bar. This helps facilitate the patient's self-care and independence as needed, as this will need to be redeveloped. And there also will help prevent skin abrasions from them scooting on the floor. Evaluation, the patient will need to see, the nurse will of course mobilize the patient, see when they're needing assistance, make sure that they're performing daily activities, daily living activities just to care for themselves. And if this is not accomplished, that is normal. This process is a very long healing process, physically, mentally, patients do need a lot of support. As far as patient teachings, the nurse will want to educate the patient and their families to inspect their limb for any signs of skin irritation, redness, abrasion, odors, any areas that are, more prone to pressure, of course, like the legs. They also want to stop using the prosthetic if any irritation occurs, having the area checked before resume using the prosthetic. Patients should wash their limb each night with warm water and bacteria soap, regardless of how it is, surgically removed or traumatically removed. It should be rinsed thoroughly and dried thoroughly. They should expose the limb to about 20 minutes of room air before putting anything back on. They should not use any lotion, alcohol, powders, anything on the residual limb. They should also wear their stockings and sock to make sure it's covered and safe and everything. They also want to make sure that they're using pain management techniques as needed. Of course, follow up with provider, if it's not accurate enough. They also want to do range of motion exercises daily, perform in general strengthening exercises, especially with the upper arm if the legs are infected. They also want to do residual limb elevation with a pillow because, of course, irritation can occur. So this should be done very mildly, only sometimes. And the patient should be laying prone with hip extension for about 30 minutes a day, about 3 to 4 times daily to help with some of the strengthening and relaxing of that area since it is going to be quite tough to do. All right, and that is going to be it for the two conditions for the musculoskeletal condition when we see most commonly with patients. And that is it. Thank you.